Let us now go to visual diagnosis of the chest. The topic is protruding sternum and chest sunken on one side. The protruding sternum is either hereditary, in which case it is due to a constitutional deficiency of the lungs and kidneys, or it is caused by retention of phlegm in the lungs. Here we can see a picture of a protruding sternum. For constitutional deficiency of lungs and kidneys, the sternum will be protruding with poor constitution, propensity to catching colds, lower back ache, a history of repeated chest infections during childhood. Other symptoms and signs depend on either where there is yin or yang deficiency. For phlegm in the lungs, the sternum will be protruding with feeling of oppression of the chest. There will be cough with expectoration of profuse sputum, sputum in the throat, breathlessness, wheezing, swollen tongue with sticky coating, and a slippery pulse. For chest sunken on one side, the chest can become sunken on one side either because of a deficiency of the lungs, specifically affecting one lung, or because of retention of phlegm fluids, often with blood stasis. Here we can see a picture of a chest sunken on one side. For lung yin deficiency, the chest will be sunken on one side. There will be dry cough, weak voice, dry throat with desire to sip water, hoarse voice, night sweating, tiredness, tongue without coating in the front, and a floating empty pulse. For phlegm fluids in the lungs, the chest will be sunken on one side with abdominal fullness and distension, nausea, vomiting or watery fluids, dry mouth without a desire to drink, shortness of breath, dizziness, a feeling of oppression of the chest, swelling of the limbs, expectoration of thin, watery sputum, inability to lie down, the swollen tongue with sticky coating, and the pulse will be deep, wiry, or deep slippery. For phlegm fluids in the lungs with blood stasis, the chest sunken on one side, there will be also abdominal fullness and distension, nausea, vomiting or watery fluids, dry mouth without a desire to drink, shortness of breath, dizziness, a feeling of oppression of the chest, swelling of the limbs, expectoration of thin, watery sputum, inability to lie down, swollen tongue with sticky coating, purple lips, chest pain, purple and swollen tongue with sticky coating, slippery or wiry pulse. Thank you so much for your attention.